5 sense organs. Sense of sight.
Hi, I am Uri. Today we learn about sense of sight, eyes. We will learn 7 parts.
Part 1, Introduction. Part 2 and 3, Instructor's script and explanation on how we see images. Part 4, Parts of the eye. Part 5, Tears. Part 6, Common diseases of the eye. Part 7, How do you protect the eye? Does anyone know how to play I Spy? You can even play this like mentioning an object on the class, etc. Can anyone tell me how you can spy things around you? What sense do you use? Sight, eyes, vision.
Repeat after me. Sight, eyes, vision.
Now close your eyes. Can you see anything? You would not be able to see anything without your eyes. Hence today we are going to learn how we see with our eyes. Part 2 and 3, Instructor's script and explanation on how we see images. It is important to understand how we see images with our eyes. We must understand how the human eye process images. The study of how human body works is called physiology. The study of human body's structure is called anatomy.
Apparently, we see objects by our eyes. Now imagine at nighttime, when all lights are off. You with your eyes opened, can you still see objects around you? The answer is no. Do you curiously ask why? It is because you can see only the objects that reflect light rays. To see objects in the environment there must be light.
Let's learn deeper. Does any one of you know that within our eyes, there is a small transparent lens like a camera lens? When light hits an object, light bounces off the objects and reflects to the lens in your eyes.
Let me tell you an easy object example. It is like looking at the moon in the night sky. The moon does not emit any light, but it reflects light it gets from the sun. Therefore, we can see the moon at nighttime. The sunlight still gets to the moon. Just like that. Light has to bounce off the objects and reach the eye to see images.
The lens of the eye helps to focus the images we see. Just like a camera lens, it helps us to see images near to us as well as far away from us. How could the lens in our eyes do that? The diagram below explains how it is done. When an object is far away from our eyes, the light rays that reach the lens are nearly parallel to each other. Therefore, the lens must be nearly flat or have a very low curvature to focus the light onto the retina. Therefore, when we are looking at objects that are far away, the lens reduces its curvature. When we look at an object near the eye, like reading a book, the light rays that reach the lenses are diverging, traveling away from each other, therefore the lenses has to somehow bring them together, converge to focus that rays onto the retina. In this instance, the lens must increase the curvature and become more rounded. There are different types of lenses and you will learn them when you grow up. The eye lens is convex, which means they are rounded on the outside. This helps to bring the light rays together, as shown in the diagram above. Another important character of the human eyes that will surprise you. The next important thing we must know is that the original image formed by the lens on the retina is upside down. As illustrated by the diagram below, when the light rays travel through the lens, the rays at the top is projected to the bottom and the light rays coming from the bottom of the object are projected up. This makes the image formed on the retina upside down.
Did you just ask in your mind but I didn't see upside down images of the surrounding?
I have not finished yet. Later, the brain processes the images back to its original position, and then we see the image as it is.
So, the brain processes the images back to its original position. I get it.
Having learned the mechanism of how we see images, which is called the physiology of humans' eyes, let us now learn the important parts of the eyes that help us see. Part 4. Parts of the eye. 1. What parts of the eye we can see from outside. 2. What parts of the eyes we can see inside.
Can you tell me, what parts of the eye we can see from outside?
Yes, of course. First, lower and upper eyelids. This is the outermost covering of the eye made from the skin. When I asked you to shut the eyes, eyelids come together and block the light entering the eye. When we sleep, our eyelids are shut. But did you know most of the animals can sleep with their eyes open? Next, eyelash. These are hair that grows on the edge of the lower and upper eyelids. They help to protect the eye from dust and other small debris.
Do you know the name of the white part of your eyes?
Sclera is the white outer layer of the eyeball. It is opaque and prevents unnecessary light from entering the eye. When you stand in front of a mirror or look at someone's eye, the white-colored area you see is the sclera.
Did you ever wonder why some people have blue eyes, some have black and some have brown or even green eyes?
The color of the eye is caused by the iris. We are all beautiful with different eye colors.
Did you know a different function of iris?
Yes, iris helps to change the amount of light reaching the inside of your eye's structures. Advanced explanation. Iris helps to change the diameter and size of the pupil. A student in my previous class surprisedly asked, "What? Iris can change the size of students?" He was from England, and in England, pupils are students. In fact, pupils have a different meaning. 5. Pupils. This is the black dot in the center of the eye. The light enters the eyeball through this opening. So iris changes the sizes of the pupil dots to control how much light enters your eyes. The pupil can become bigger or smaller depending on the amount of light brightness in the surrounding environment. If the environment is too bright, the pupils become smaller and reduce the amount of light entering the eyes. If the environment is dark, the pupils dilate, making more light enter the eyes. This is the pink globular structure that is visible at the inner corner of the eye. It is the skin covering of the sebaceous and sweat glands. We have discussed the sweat gland and the sebaceous glands under the lecture on skin. These are parts of the eyes you can see from outside.
Let's review with me. 1. Lower and upper eyelid. 2. Eyelash. 3. Sclera. 4. Iris. 5. Pupil. 6. Lacrimal caruncle. Now I learned about parts of the eyes that we can see outside. Can you tell me more about what parts of the eyes we can see inside?
Yes, the next part is, what parts of the eyes we can see inside. Now we will open the eyes up and see all the inside parts of the eyes. We will identify each part from outer to inner, from anterior to posterior. Anterior chamber. Chamber means room. Anterior means front. Your eye has two rooms, divided by a lens. The front room is called anterior chamber or anterior cavity. Cavity also means hole, space, room. So anterior chamber is the room in front of the lens. Anterior chamber is filled with aqueous humor. Aqueous humor is the clear fluid filling the anterior chamber, which is between the cornea and the lens.
Chamber means room. Anterior means front. The front room is called anterior chamber or anterior cavity.
Cornea. At the center of the sclera, there is a transparent part that allows the light to enter the eye. This area is called the cornea. It is conical in shape. Remembers it has two corn muffins in the center of the eye. Why does your eyes have this conical shape of the cornea? Because the conical shape helps light focused better. This transparent conical layer covers the pupil and the iris. Aqueous humor is the clear fluid filling the anterior chamber, which is between the cornea and the lens. Aqueous humor is the clear fluid filling the anterior chamber, which is between the cornea and the lens. Iris helps to change the diameter and size of the pupil. Pupils. This is the black dot in the center of the eye. The light enters the eyeball through this opening. So iris changes the sizes of the pupil dots to control how much light enters your eyes. Pupil. This is the dark circular shape at the center of the eye. It is nothing more than a black hole that allows the light to enter the eye.
When you are at home, go to the bathroom and stand in front of the mirror. Keep your eyes shut for about 2 minutes and then open them. You will see the black hole at the center of the pupil is large and it gets smaller. Now shine a flashlight at your face, make sure it is not too bright to hurt your eyes, then look at the mirror, you will see the pupils are very small compared to before.
Lens. This is found inside the eye. The lens helps to focus the light on the retina at the back of the eye. The lens is just like a handheld lens we use to magnify things. It is transparent and curve outside on both sides, see the images. This character is called biconvex in shape. It is biconvex because the human eye can change the curvature of the lens to focus objects that are at different distances from our eye. This is just like the lens of a handheld microscope, the one used by detectives. It is transparent and has two curved surfaces. The human eye has a fascinating lens. It is not like the glass lenses found in the store. The human eye lens can change its curvature. Remember, the lens is a lentil which is shaped like the lens. When you look at things that are far away, the lens becomes flat and reduces the curvature. When you look at things close to you, the lens becomes rounded and increases the curvature. Ciliary body. This is a muscular structure that extends from the iris. Did you ask how human lenses can change shapes from flat to curved? It is the ciliary body help to control the curvature of the lens. What else can this eye muscular structure do? Ciliary body also helps produce the liquid jelly-like substance called the aqueous humor, which is filled inside the anterior compartment. But what holds the lens in place to the ciliary in place inside the eye? We need a structure with rubber band character to pull the lens flat to curve and from curve to flat. We know that light rays hit the eye's lens, but how do our brain read the light rays information? The retina is like the computer of the eyes. Retina reads the light rays information. Retina converts the light rays to electrical signals that will be sent to the brain to understand. Whereas in retina computer station located in our eye. Retina. This is a thin layer found at the back of the eye. It is located near the optic nerve. Of course, because after retina converts the light information to electrical information, optic nerve will carry this electrical information to the brain. How convenient it is. Retina contains very special nerve cells called rods and cones. Rods and cones are responsible for converting the light rays that are collected by the lens to electrical signals.
Which area on the retina contains the most cone cells?
Fovea. This is a tiny pit found in the retina of the eye. This area has only the cone cells, and when the light is focused here, it gives the very sharpest of the images.
Which area of the retina provides sharp images?
Macula. This is an area in the center of the retina. This provides a central vision that is very sharp. It helps us to read, drive, and to see fine details. Cone cells. These are specialized nerve cells. They are found on the retina and are shaped like cones. These cells are responsible for giving us the color vision. Rod cells. These are specialized nerve cells found on the retina just like the cone cells. They are shaped like rods. They are concentrated on the edges of the retina and help in peripheral vision. The rod cells help to see in the low light conditions. Sclera. The sclera is the white-colored outer layer of the eye that is visible to us. It is commonly called the white of the eye. Sclera provides the protection and the form of the eye. It is the protective outer layer of the eye. Sclera is the white outer layer of the eyeball. It is opaque and prevents unnecessary light from entering the eye. When you stand in front of a mirror or look at someone's eye, the white-colored area you see is the sclera. Ora serrata. This is the serrated junction between the retina and ciliary body. Serrated means saw-like shape. Serrated means saw-like shape. Choroid. This is a layer that is found between the retina and the sclera of the eye. It is highly vascular, which means choroid has many blood vessels that supply oxygen and nutrients to the structures of the eye. Optic nerve. This is the nerve that carries electrical signals that correspond to the light rays which hit the retina, to the brain. Posterior back eye cavity. The lens divides the eyeball into two compartments. The anterior cavity is the part in front of the lens and the posterior cavity is the part behind the lens. The anterior cavity is filled with aqueous humor. The posterior cavity is filled with vitreous humor. This jelly-like fluid substance is secreted by the ciliary body.
Posterior means back. Posterior chamber or posterior cavity or means back room. Now, let's review what parts of the eyes we can see inside. 1. Anterior chamber. 2. Cornea. 3. Iris. 4. Pupil. 5. Lens. 6. Ciliary bodies. 7. Retina. 8. Sclera. 9. Oris aorta. 10. Choroid. 11. Optic nerve. 12. Posterior chamber.
Part 5. Tears. Besides seeing, what else can your eyes do?
Crying, isn't it?
Correctly. Now we will learn how your eye produces tears. Anybody can tell me where your tears come from?
Please, let us know.
Listen, your tears come from a sac-like structure named lacrimal gland.
What?
Lacrimal gland. Lacrimal means weeping or crying. A gland is an organ which produces and releases substances in the body. So lacrimal gland is a gland that secretes tears. This is where your tears come from. Repeat after me. Lacrimal gland, lacrimal gland.
Lacrimal gland, lacrimal gland. Lacrimal means weeping or crying.
Look at the eye's image. Do you notice the small pink area at the corner of the eye? It has a name. Lacrimal caruncle. This is the pink globular structure that is visible at the inner corner of the eye. It is the skin covering of the sebaceous and sweat glands. We have discussed the sweat gland and the sebaceous glands under the lecture on skin.
Why do we get stuffy nose when we weep?
It is because we have two small tube-like drains that tears drain into the nasal cavity. Cavity means a hole. Nasal is related to nose. Nasal cavity is the cavity in your nose.
Cavity means a hole. Nasal is related to nose. Nasal cavity is the cavity in your nose.
Lacrimal canals. These are two small tube-like drains that remove the tear from the surface of the eye and drain it to the nasal cavity. Canals are waterways channels. Lacrimal canals are secreted tears from the lacrimal glands then travel across the surface of the eye and drain through the lacrimal canal into the nasolacrimal duct. Through the nasolacrimal ducts, they drain to the nose and the throat. Naso means nose. That's why when you cry, you get your nose wet and stuffy.
Canals are waterways channels. Naso means nose.
These three structures, lacrimal gland, lacrimal caruncle and lacrimal canals, are called lacrimal system. Besides crying, the lacrimal system plays an important role in the protection of the eye. Do you know that, up to date, scientists do not know why humans cry when they get emotional? They are unable to explain the basis of lacrimation or secretion of tears in those situations. You can be the next scientist to discover that. You can also take our emotional intelligence course to learn more about how to manage and develop your emotional intelligence to live a happy and successful life. Back to the tears system. There are some more interesting facts about it. Lacrimal glands are almond-shaped structures located in the upper lateral part of each eye. They secrete a thin film of tears, and when the eyelids close every time we blink, it helps to spread tears evenly across the surface of the eye. This keeps the surface of the eye moist and prevents it from becoming dry. What happens if your eyes get too dry? If the eyes become dry, it can cause blurred vision. Dryness increases the risk of eye infections. Tears also have different substances in them that help to kill germs. Now, we go to part 6. Common diseases of the eye. Conjunctivitis is what we normally call the pink eye. Pink eye or conjunctivitis is an infection or an allergic reaction of the eye. Your eyes will appear reddish and you may have an itchiness and a gritty feeling. A discharge can come from the eye that forms a crust at night by drying out. Your eyes will water frequently. If you have this condition, your doctor will recommend an antibiotic eye drop to fight the infection. Corneal abrasions. Corneal abrasions are scratches that occur in the central transparent layer of the eye. This usually occurs due to an injury to the eye. Small scratches like this can be cured by wearing an eye patch for a few days, but larger ones need more complex interventions. So, make it a point to protect your eyes from injuries at your best. Long-sightedness. You may have noticed that your grandmother wears spectacles when she read newspapers, but recognizes you from distance. She has long-sightedness, which is the ability to see distant images while there is an inability to see nearby images. A pair of glasses convex can correct this impairment. This usually occurs when you are around 40 years. Short-sightedness. Some of your friends may be wearing spectacles. Have you ever wondered why? Usually, they can see nearby objects but cannot see faraway objects. This is opposite to what your grandmother has. This defect can also be corrected by wearing a pair of glasses concave. Do you think you can prevent short-sighted? You cannot prevent getting short-sightedness because it occurs in people having large eyeballs. When the eyeball is too large, the image cannot be focused on the retina, instead, it falls in front of the retina. But you can prevent its progression by undergoing regular eye checkups to detect any visual impairments at its initial phase. You should be keen to use glasses prescribed by a well-trained eye specialist. Once you have grown, you may undergo laser eye surgery to correct the defect permanently.
So, what should I do to protect my precious eyes then?
Okay, first, you should protect your eyes from excessive sunlight exposure. Next, it is mandatory to sleep well. Then, avoid unnecessary strain on eyes such as playing video games or watching the computer screen for long hours. Finally, make sure to use a good light source when you read.
So we review again. What should I do to protect my precious eyes? 1. Protect your eyes from excessive sunlight. 2. Mandatory to sleep well. 3. Avoid unnecessary strain on eyes such as playing video games or watching the computer screen for long hours. 4. Use a good light source when you read. Do you know that some people do not see all the colors in the rainbow?
This occurs due to an abnormality in cone cells, which detect light. Do you remember the cone cells we have learned earlier? There are many forms of color blindness, but the most common one is the inability to differentiate green and red. This will run in your genetics. People having red-green color blindness find it difficult to interpret traffic lights. Ishihara color test plate used to test whether a person is having red-green color blindness. If he is having color blindness, he is unable to read the number 74. Blindness. Blindness can occur due to many reasons. Vita deficiency is one such cause. Therefore, make sure to eat lots of veggies and fruits that have lots of vitamins, especially vitamin A. A severe trauma to the eye can cause blindness. Other than these, an abnormality in the retina where the image falls, optic nerves and its pathway to the brain, and even some abnormalities in brain can cause blindness. Uncontrolled long-standing diabetes is a very common for blindness. We move to the last part of the lesson. Part 8. How do you protect your eyes? 1. When you select sunglasses, select one which has UV protection. There are 3 types of UV rays. A, B and C. UVC rays are absorbed by the ozone layer. Both UVA and B can damage your eyes. It can cause degeneration of the macula with time. This is called age-related blindness. That's why when you grow old you gradually lose the ability to see. If you want to have good eyesight even at 80 years of age, always wear a pair of sunglasses that has UV protection when you go outdoors. The glasses should be able to block 99 to 100% of UVA and UVB and should screen out 75 to 90 of visible light or glare.
You can use hats or caps and sunglasses as well to protect your eyes. Avoid looking at the sun directly.
2. Do not touch your eyes or rub them often. This can introduce infections to your eyes. 3. When you are swimming, always make sure to use goggles. 4. When you engage in risky activities that can harm your eyes, always wear eye protection. Your eyes can suffer blunt trauma when doing sports such as skiing, basketball, racket games, etc. Even contact sports can damage your eyes by the impact of fingers or nails of fellow players or mud in the ground. Chemical injuries can occur when you use spray paints, fumes, etc. Dust is very harmful to your eyes, so wear protective eye equipment when you clean the house. 5. Protect your eyes with cream, powder and chemicals. Most eye injuries are minor. You do not have to worry if something like soap or dust goes into your eyes. Simply wash your eyes well. Your parents can take a few steps when a particle enters your eye until you meet a doctor. Parents should wash their hands well, before touching your eyes. Then they should turn your head over a sink with the injured eye pointed downwards and flush the eyes with water as soon as possible. Continue flushing until the foreign body is removed. Immediately see a doctor if there is a blurring of vision, redness, swelling, eye pain, irritation and sensitivity to light. Even though you do not have any symptoms after the introduction of a chemical to the eye, it is wise to see a doctor as soon as possible. Get adequate sleep. Eat green leafy vegetables which have plenty of vitamins such as vitamin K, and orange or yellow color fruits like mango. Oranges that are loaded with vitamin C. Carrots are a rich source of vitamin A, which is essential for the color vision. Fish and fish oil are rich in omega-3 and 6 fatty acids and vitamin A that helps to maintain visual integrity. 7. If your eyes are dry and gritty, use lubricating eye drops such as Refresh Tears. 8. If you have a difficulty in seeing, immediately consult a doctor.
Now, let's review again. 8 ways to protect your eyes. 1. Select sunglasses which has UV protection. 2. Do not touch or rub eyes often. 3. When swimming, always use goggles. 4. In risky activities, always wear eye protection. 5. Protect your eyes from cream, powder and chemicals. 6. Get adequate sleep, eat green leafy vegetables. 7. If your eyes are dry and gritty, use lubricating eye drops. 8. If you have a difficulty in seeing, immediately consult a doctor.